Hello, everybody. Thank you so much for joining today. We are so excited to share that Dr. Shelley Collins is joining us to talk about how our organization is making a tangible impact at UF Health Shands Children's Hospital. During this time from 12 to 2, we are striving to raise $44,000, and I cannot wait to see what this impact will have on the children and families being treated right down the street. We have the opportunity to ask Dr. Collins some questions throughout her presentation. So if you are logged in online, feel free to leave those questions in the chat. And we also have a text option, so you can text chat live to 41372 with those questions as well. Without further ado, I'm going to hand the floor over to Dr. Shelley Collins.
Thank you, Sydney. Hi, everybody. I'm so happy to be here, and I want to welcome you to Transform Today. It's a great opportunity for us to share with you some of the wonderful things that we're doing over at Shands Children's Hospital. Couple things I wanted to say first. First and foremost, thank you to all of the students who are joining and working with Dance Marathon and helping us to achieve all of the goals that we have for the patients that we take care of every day. That's a really incredible commitment from you for our patients. And so I just want to say thank you for that. I also want to welcome any parents or families who are watching today so that you can maybe get a glimpse into how your students are spending their time as they help us, again, achieve our goals for our patients. And those goals are varied, right? It can be around specifically patient care related activities, research, and then we're going to talk a lot today about the renovations of our children's hospitals. So I want to thank the parents and then, of course, any of our alumni who are on the call today and watching the stream. I think that you guys are well aware of how much time and effort it takes to provide this level of support for our children at the Children's Hospital. Today, I want to talk about our renovations, and I'm going to show you some renderings of our Unit 44 transformation. It began a few months ago, and they're making considerable progress. And so I want to show you some of the drawings of what the hospital will look like, and I think there's some comparisons to what it did look like. And so we're happy to see what it did look like go away. So maybe we can start flipping through the slides and I'll just talk a little bit about what it's going to look like. So next slide. So lots of you have come up to our unit to see what the Children's Hospital, to visit our kids and to do tours on the unit. So on the left-hand side of this slide, or what's my left-hand side, you can see the old welcome desk and what the families would come to as they walked onto the units. On the right-hand side is what the welcome area is going to look like, and it's going to be nice and bright with our forest theme there with good signage and a nice TV behind that'll have lots of information scrolling on that television. Next slide. So this is the family waiting area. So today we actually don't have a family waiting area at all. And even though our process will leave us with private rooms for all of our patients, when you have a child in the hospital, even with a private room, sometimes you need a space to just step away from what's going on. And so this is also an area where families can gather as larger groups. This is a space where we as physicians can meet with families if we need to talk to them about next steps in treatment. The space itself will have dimmable lighting. It will have comfortable furniture. It will also have lots of ability to connect. So parents who need to go somewhere to do a Zoom meeting for work, for example, this is a good spot for them to be able to do that. The TV that you see up on the wall there, of course, this is just a rendering, but it will have capability for us to connect to the electronic medical record as well. So when we are doing family meetings, we can pull up things like scans or x-rays or labs that we want to share with the families so that we can really talk in detail about what's going on with their loved one, with their child. Next slide. So you guys have probably spent some time, the students at least, in the playroom on the fourth floor. And this is a well-used space by our patients, little kids, bigger kids. There's a pool table there that historically our patients have really loved using. And so on the left-hand side is what we had. On the right-hand side is where we're headed. And so this space is going to be a multi-purpose room, actually. This is for our teenage patients, the space that you're seeing on this particular screen. It will have 6 55-inch TVs that this kids can use either to game alone or with each other. We can watch sports on there. We can watch movies on there. We can make it one large screen for the kids, depending on kind of what they're feeling. The pool table will be in there, so the kids can play with the pool table. We'll also use this as a meeting space for our residents, for our nursing staff. If we need to do leadership meetings, we can use this space to do those leadership meetings. But it's really a space for our teenage patients, which is going to be different than our toddler space. Before, they had to sometimes be combined, which is not ideal because I don't know about you guys, but most teenagers don't necessarily want to hang out with toddlers, especially when they're trying to game. So that's going to be our new teen activity room. Next slide. Oh, this is kind of my favorite part. I get to go walk through the construction site, which is fun for me. They don't make me wear a hard hat. They probably should. But anyway, this is just what the teen space is starting to look like. You can see we have completely gutted. Well, I didn't do any of it. The guys have completely renovated or gutted the space upstairs. So when you walk through it, you can really start to see what it's going to transform into. It's actually very exciting. Next slide. This is the toddler or infant space that we have on the fourth floor. And again, you can see on the right-hand side, it's going to be much brighter, lots of designs on the walls, lots of storage because we have a lot of things that we have to store for our kids. And the space is just going to be obviously a place where our kids can leave their room if they're able and go and play and be little kids, which is what we want them to continue to do. We'll also have the technology on the walls, as you can see, so we can put movies, we can do different kinds of interactions with our younger patients in this space as well. Next slide. So the biggest change that we are going to see is, of course, on the main corridors and in the patient rooms. So on the left-hand side is what the 44 unit looked like before. Of course, they gutted it to the studs, and it's not a bad space. We took great care of patients in those spaces, but it was a little dark, and the sight lines for the nursing staff and the physicians was not great. And so you can see on the right-hand side, the space is going to be much more accommodating for patients and staff. And so every 2 rooms will have a nursing alcove where nurses or physicians can really see the patients from the hallway so that we don't necessarily have to disturb the patients to be able to see how they're doing and see their monitors. The area itself is much brighter. There are there's art on the walls. You can see that will also be backlit so that really you feel like you're in a calm nature environment. There are also spaces on the wall there that you can see where we'll have gowns and gloves, which right now sit on or in acrylic holders on the wall, which is not ideal. And so all of this has been incorporated into the design, as well as plenty of storage, which we desperately need on all of these. Next slide. So the nursing areas on the left-hand side, this is what 44's nursing work area looked like before the renovation. And what you see on the right-hand side is where we're headed. And so our goal in designing the center part of the new unit was actually to make sure that we had plenty of collaborative space for the nursing staff, the physician staff, the respiratory therapy staff, and anybody else who needs to be there to take care of the patients. And so we wanted to make sure that the nurses had plenty of area to work and do their charting if they weren't in the patient alcoves. We also wanted to make sure that as people came onto the unit, they could stop at the desk and be greeted by our unit clerks so that they could be directed to the proper patient space. But again, you can see everything is very bright and open, which was critical for us. Next slide. And this is just another, you can see where they are in the gutting of the unit, which again, I like going in there because I can see the progress. It's really amazing, actually. Next slide. And then this is the collaborative space. So right now, today, our physician or the residents sit in a space that is not connected to where the nurses are working. Medicine and the care of patients, pediatric patients in particular, but all patients, is a team sport, and we should not be separated by closed doors. We need to be working together in the same space. And so the way we designed this was to have this closed in, it's glass, closed in space where we could have private conversations about patients and their treatment with our nursing colleagues and any other ancillary staff who help take care of the patients. It's private, but it's connected. And this was really critical for me. This was a sort of a deal breaker for me as we designed the unit. I needed and expected the teams to be able to work together in a large space. And again, the lighting is really important. When you're in the hospital, having dark lighting is hard, and it makes everyone tired and a little grumpy probably. And so having bright lights and a space that is open and airy with plenty of computers for us to be able to chart was actually very critical. Next slide. So it's a funny thing to be excited about bathrooms, but I am. So our bathrooms in the current space on 44 and 45 is very small. The doors open outward, which is a problem. It creates a space issue in the rooms, and getting a normal sized wheelchair in the bathrooms was very problematic. And so our bathrooms are going to be nice and wide and open and safe for our patients. We have barn doors instead of doors that open out, which allowed us some space saving opportunities as well. But again, they're nice and bright, but most importantly, they're safe, and we can get in and out of those bathrooms with the patients and not worry that our kids can't get in there or we can't get in there if they need us. Next slide. The patient rooms are going to be beautiful. So on the left, you can see that our patient rooms, for the most part, on 44 and 45 are double occupancy rooms. We are moving to a completely private room situation for all of our pediatric patients. On the right, we designed the rooms to be very workflow positive, right? So our nurses, the nursing staff, the charge nurses and the nurse managers were very important in the process for how we designed these rooms. We wanted the workflow to work for them. They're at the bedside all the time, right? I get to bop in and bop out like Bon Jovi, but they have to be at the bedside all of the time. And so making sure that the rooms worked for how they take care of patients was critical. So the placement of the computer, the placement of the sharps box, where the garbage cans were, was all part of the decision-making process. How many plugs do we need? Making sure that we have an iPad for the patient so that they can see it from the bed, as well as the technology that's going to be available for them on the cross wall from where the patient sits. And then we have a family space over in the corner there on the right that was also really thought through. Our parents sometimes are there for weeks. And so making sure that they have a space that they can call their own television, a space where they can work if they need to. All of this was really important to us. Next slide. So this is just on the blue room. So I'm not going to go into too much detail. It's exactly the same, just on the other unit. Next slide. And then just the picture of the construction site, which again, I love looking at, but you guys probably don't care that much about the construction site. But when I look at these rooms, I'm like, oh my God, there's so much room in here. What are we going to do with all this space? But don't worry, we'll figure it out. Next slide. So the treatment room on 44 was tiny. And so this is a place where we would take patients if we had to do any kind of procedures, like a lumbar puncture, a blood draw, burn debridements for patients. And the space was way too small. And so one of the things that we talked about as we thought about this renovation is both we need a space that's large enough for enough people to get in there to take care of the patient, but we also need it to be calming for the patient. We need to have technology available so patients, if they're laying on their back, they can look up at the ceiling and watch a show or a movie. We needed a shower room or a bathroom that was connected to the treatment space so that we don't have to take patients who have significant burns up to the ICU to debride their wounds. We should be able to do that right on the unit. So I'm really excited about this space. We try never to do noxious treatments to patients in their rooms because those are their spaces. And so we needed to have a space where we could safely bring patients to do some of these procedures that we have to do. We don't like doing them, but we have to do them in a place where we can really provide the support for the patients that is necessary. Next slide. Okay, so those are the slides for the renovation, and we're really excited about that. I hope that this helps the parents in particular understand what your students are helping to raise money for. We've been doing Dance Marathon for 31 years here at UF Health, Shands Children's Hospital, and these guys have raised $32 million over those years, which is really a considerable achievement. And so we do want to thank everyone for doing that. I think that this is a real opportunity that if you feel moved to add to their support and donate, you can text at the number that you see scrolling down below. I think the idea is to text $44 if you feel so moved, because the unit that we're renovating right now is unit 44. We don't say no to money, so if you want to text more, feel free. But the tagline is the $44. So with that, I think I'm going to turn it back over to Sydney and just thank everybody for your time.
Thank you so much. We do have one question that came in, which was, what is your favorite part of the renovation, or what are you the most excited for?
So it's not super fun to say the bathroom. I am really excited about the bathroom. But I'm actually, gosh, that's a hard question because I'm really very excited about all of it. I think the two things that I'm most moved by are the treatment space that we have for the patients, and then our collaborative workspace, because I like working closely with the nurses and taking care of the patients. And I think demonstrating that and modeling that behavior is really important for our residents.
Well, that was the question that we had come in. Thank you, Dr. Collins, for that inspiring presentation. It's amazing to see how our efforts directly impact the lives of these children and their families. Like we've been talking about over the course of Midday Miracles, we are striving as an organization to raise the $44,000. So if you're able to, take a moment to text DM at UF to the 51555 or visit our website to donate. Thank you so much again, Dr. Collins, for joining us today. Have a great day.
Thank you. Thank you, everybody. Bye-bye.